We're going to talk. Well, let me start by telling you who I am. I am Dr. Terry Harrison Goldman, and I am the neuropsychologist at the Baker Center. And I will talk a little bit towards the end of the talk about sort of what neuropsychological services we have at the Baker Center. It's a pretty new or reestablished program there. So I'll give you a little bit of information about that as we finish up. But unfortunately, and again, I apologize, we're starting a little late. We have a lot of content to go through. We're going to be talking about executive function, and then towards the end, we're going to talk about an organizational skills training program. Just a couple of quick things to go over. This series of educational talks is presented free to the community, courtesy of the Metric Grant funded by NCTSN. I don't have any personal disclosures, although I do want to make sure that everybody is aware that a lot of the talk towards the end is based off of the organizational skills training book for children with ADHD by Abkoff and Richard Gallagher's book, which is a manual and very specific. And it's a great book if anybody's looking to learn. So today, my objectives are to define executive functioning, go over some of the primary executive functions, describe them in detail, and then again, we're going to review the organizational training program. Um, a couple of quick housekeeping things. I'm going to ask people if you have questions to just throw them in the chat. And then towards the end, I hopefully will have some time. I built in time, but I got late. We'll have time for questions and any information that comes out. This is meant to be an informational webinar. It is not going to answer questions about specific individuals. But as I mentioned towards the end of the program, I'll talk to you about our wonderful program that we have. So if is there more information that you have or specific things, we have lots of services at the Baker Center that may be able to help. So we're going to get started. And I have to admit, I am somebody that loves cartoons, humor. And this one, I don't know how well you can see it, but it's one of my favorites, Dennis the Menace. And he's sitting in his chair facing the wall. And it says, by the time I think about what I'm going to do, I already did it. And I'm sure most of us have seen children like this or sometimes felt like this. But that's sort of the crux, if you will, of ADHD and some executive functioning weaknesses. A few things to think about first, and we're going to get more in depth about executive functioning, is executive functions are brain functions used to manage attention, emotions, and then pursuit of our goals. They typically are thought to emerge in the preschool years. We'll talk a little bit about sort of which specific ones develop sort of when we think they develop when, but they don't often mature until early adulthood, and sometimes they don't ever mature. They are more predictive of school success than an IQ measure, and they depend on our prefrontal cortex, which I'm going to show you a picture and talk a little bit more about. There's one picture, but we're going to see more. Um, so executive functioning globally or generally is what to do, knowing what to do and knowing when to do it. So to make a plan and to finish things by the end of class, to write down your assignments at the end of class. It's also knowing how to do it, which is cueing the rest of the neural network to perceive, think, and act. So, for example, to make, as a child comes into class, to know that they have to pull out their pen or pencil, their planner, then look at the board, listen, and then put down the details. So, the how of executive functioning. Some of the core higher order executive functionings, and I'm going to sort of backtrack for just a second here, that if you Google executive functions, you'll see that there are lots and lots of information out there. And there are differing sort of theoretical points of it too, although they're often overlapping. One definition says executive functionings, excuse me, refer to the mental skills that allow an individual to control their attention, um, plan and organize, regulate their emotions, and complete tasks to achieve a goal. Another one says that's one's ability to manage everyday tasks, planning, solving problems, adapting to new situations. And then one that I typically rely heavily on is that it's so executive functions, or other terms that we use, executive control, cognitive control, are a family of top-down mental processes that are needed when one has to concentrate and pay attention, and when going on automatic or relying on our instinct or intuition will be ill-advised, insufficient, or problematic. So when we go with the flow, if you will, or just do our impulses, that's not the best mode of attack. Um, Using executive functions is effortful. As you can imagine, it's easier to continue doing what you've been doing than to change. It's easier to give in to temptation than to resist it. Um, And it is much easier than learning how to do and manage and do something in a different way. So as you can see, executive functions is a broad term, and sometimes not always agreed on, and or agreed on the specific points of executive functioning. However, there is some agreement about the core executive functions, and those are here, and we're going to get into them in more specifics now. So there's the majority of the researchers out there sort of agree on this three core executive functions. But there's also, I'm going to go over the seven core executive functions. It's also one that's often thought about. So here we have working memory, which is, sorry, let me get a quick drink of water. So working memory is holding information online and being able to manipulate that information, and then be able to use the information. So used to make sense of information that is coming in, events that we've happened, and this research shows that working memory starts to begin to develop during childhood and into adolescence and kind of reaches its peak, if you will, at 30s. Now, me, who is nowhere near 30 anymore, is a little worried about that, but they still continue on. But they do start to they decline a little bit, if you will, or start to plateau, although I don't like that word plateau. As you get older, as you can imagine, your working memory can get impaired by other things, attention, and lots of things coming at you. Working memory relies more on the dorsolateral prefrontal cortex, and it is different, or it's felt to be distinct from what we call short-term memory. And this is an interesting distinction. So working memory, again, is the ability to hold information online and manipulate or use that information. So like if you think about doing an arithmetic problem in your head, whereas short-term memory is just holding information online and that maintenance of that information. So just forward digits, if you will. And that is considered more to be in the ventrolateral prefrontal cortex, and doesn't necessarily utilize or activate the dorsolateral prefrontal cortex. The next core area of executive functioning is cognitive flexibility. And as you can imagine, cognitive flexibility is being able to think flexibly, to adapt to change, whether it's a personal situation or a change in the environment, go with the flow, go with the punches, roll with the punches, if you will. And it's the ability to sort of change smoothly or shift gears smoothly between tasks, thought processes, and situations. Um, for example, if you're in the middle of solving a problem and all of a sudden you're realizing that your approach to it or your problem solving strategy isn't working, how do you change and how do you adapt to that situation and continue on? It also involves the ability to multitask. So if you're in a situation and your colleague comes up and they're talking to you while you're writing an email, being able to do both tasks and sort of manage that is part of cognitive flexibility. We think it also involves being able to use empathy. So thinking about another person's perspective or from their point of view. And then for cognitive flexibility, we think that starts around the age of 3, which is a really interesting concept because we feel like kids are beginning to pick these things up. But quite honestly, we do not have measures that look at this in a real sensitive way. You may know about the flanker test, some of the tests that we use where kids are using very basic cognitive flexibility. And that task is where there are little fish that are all going one way, but the middle one may go the other way, and they have to point to which way on the bottom the fish is going. So being able to sort of think flexibly and look and attend pretty closely. Other ones is like the brief preschool, which looks at some executive functioning skills, but there aren't great measures at the younger ages, but we feel like they're coming in place and that we can start working on some of those skills early on. Kids are better off later. This research shows that it sort of completes around the age of 12. And honestly, I think it's much later than that. Kids are still oftentimes working on understanding flexibility and empathy in that at a later point. The third area of executive functioning is inhibition or inhibitory control. And so this is how well one can control their thoughts, emotions, and their focus, one's reactions to certain situations and different situations. So being able to inhibit if you're in a conversation in your work environment or a child's in a conversation at school, being able to inhibit or weed out some of those external noises or conversations that are going on in your work and being able to focus on the conversation that you're having is inhibitory control. And then also that if it starts to get even extra loud and you're really working at trying to maintain your attention on the conversation, it helps inhibit that feeling of getting angry and doing something or saying something that you might regret later. And keeping and in sort of putting the brakes on, if you will, and not losing your temper. Um, Research shows that inhibitory control begins to develop around the age in infancy, because you have to inhibit certain things in a rudimentary way, and then starts to decline in your 60s. And just a personal aside, my father was in his 90s, and I've noticed a lot more lately that he's saying things that he out loud that he would never have said before. And so you can see as the brain ages that we have less ability to control some of those inhibitions or inhibit those conversations. Again, working memory, I'm just going to go over them really quickly again, holding information online. So you're following a conversation. I'm going to skip through these pretty quickly. Remembering something that was hidden, despite a delay of gratification or distractions that get in the way, and then holding in mind what happened earlier and then relating it to something that happened now. And this is really important when thinking about, teaching children that particular behavior we don't want, but and again, making sure that they understand it and they can connect it later on when they have those impulses again to do that engage in that behavior. Relating one idea to another, and then relating what you've read and from an academic standpoint to what you're learning now. Again, cognitive flexibility to think creatively, thinking about ways to solve problems that nobody else, thinking out of the box. Those are terms that often come up when talking about those things. Changing your course when something isn't working, adapting to change easily. Um, Inhibition are, sorry, saying that, is the ability to stay focused despite distraction. Um, the staying on task and completing a task, even there when faced with temptation or frustration. So, being able to complete your homework, even though you hear the neighborhood kids outside playing, or it's really hard and you're frustrated and can't get through it, but you persist and stay focused. Exercising self-control, considering a response before acting. Um, and then not putting your foot in your mouth. Also, resisting acting on impulse, um, selective and focused attention we use with when you're talking about inhibitory control or self-control, and then the ability to think before acting, and that's a big one. I hear that often from families coming in. Um, I'm going to go through these. There's other theories out there, and these are um, the same ones, but just elaborated or expanded a little bit more. So we have self-awareness, which is the ability to understand one's own thoughts, feelings, and how we're perceived by others. Um, Inhibition, which we've talked about, so pausing before acting or speaking. Nonverbal working memory. And so working memory, as you can see in the three core, is the larger one. And now this theory breaks them down a little bit more. So nonverbal working memory is being able to hold and manipulate visual information and spatial relationships, whereas verbal working memory is more speech-based and language-based information. And as you can imagine, we have been more focused on, if you will, verbal working memory because language is such a large part of learning, academics, how we negotiate with the world around us. Emotional self-regulation, so the capacity to manage and control one's emotions to achieve a goal. Self-motivation, and so the ability to stay motivated, to be engaged, to put forth effort. And then the last one is planning and problem solving. So skills needed to set those goals, figure out the steps and how to reach them. So breaking down tasks and adapt when things go awry. As I mentioned, and I'm going to kind of go through this just quickly, hopefully. So verbal working memory, so taps into the sound phonological system, so what we hear, digits forward, backward, and sequencing on our testing. And then visual spatial working memory is more of a visual sketch pad in the brain. And so envisioning something, holding it in your mind's eye, if you will. We have on the whisk, there's picture memory. So looking at something, the order of the pictures, and being able to remember those after a brief time period. Um, Also, an executive functioning skill is the time management. And I'm bringing these up because this is one of the things that I will often hear from families. Being able to estimate how much time, and they don't always use those terms, but it's like, we're getting ready in the morning. And I mean, like, we got to get our shoes on, we got to get our backpack ready and that. And all of a sudden, it's 15 minutes have passed or 10 minutes have passed, and I don't know where my child is. They haven't done what I've asked them to. So being able to understand and estimate how much time is passing is a big area in executive function. Determining how to divide your time. So being able to figure out, how to fit things into your schedule, being able, particularly for kids that do after school sports or extracurricular activities, being able to manage that time to make sure everything fits in and they're not, losing sleep because they're finishing their homework in the middle of the night. And then also staying within time limits and deadlines. So knowing that this is due then, sorry, and making sure that that they're getting those tasks completed in the time frame needed. Sorry, I'm losing my voice a little bit today. Isn't it always the case when you have to present? And here's another cartoon. Again, I love my cartoons in planning. And as you can see, there's a hole, but the tree sprouted up far away. So poor planning on their part. Um, Also, planning is determining what's important to achieve the goal and what isn't important. Um, Flexibility, again, that ability to revise a plan, adapting to changing conditions, and then also your goal-directed persistence, the ability to follow through. I love when kids will work with me and they have beautifully, their calendars are filled out, they're color-coded, they're great, and they get hung up and never again are they seen. And so being able to manage and plan, but also to be able to follow through and continue to work on these skills as they get older or get further along. I talk about brain development in executive functioning, and it's more of a marathon, not a sprint. These skills come at a pace individually based on the child or individual. The prefrontal cortex and the frontal lobes are the last to develop fully. Subcortical regions develop much quicker than the frontal cortex. And our world really demands complex or executive functioning skills earlier and earlier. So it's kind of out of sync sometimes with normal development or individual development. And we're often competing for demands for our attention. Um, Again, just going over ability. So, and this is more of when executive functions work well. And so we often don't think about this because when things are working well, we're not worried about, everything's kind of going with the flow. But good executive functioning helps kids and individuals to work independently, organize their materials, keep track of needed things, and helps with how well activities are planned and executed. And you can see in a child that has got all of these skills really well, they function well, they're less stressed, they do better academically, they're less frustrated, and a lot of the times have less anxiety and um, low mood because they can organize and keep themselves working towards their goals. Um, just a little, I've talked a little bit about this, but the prefrontal lobes, in particular, this one isn't, let me see if the next, yeah, here. So you can see here, so the prefrontal cortex or the frontal lobes, that green line going down in the middle there is sort of where we have the premotor cortex, and then you have the prefrontal cortex or the frontal cortex of the brain. And the three areas that are really important with like ADHD and executive functioning is this dorsolateral prefrontal cortex, the ventrolateral, which is the orange one, and then the orbital frontal, which is that green one underneath. And those are considered to or purported to manage or control, if you will, the areas of executive functions and attention and disinhibition and impulsivity. And that's what we also have learned as time goes on in our neuroimaging and research methods have really improved. We used to think that that was the main area, and it is the main area, but it's a circuitry. So you can also have the basal ganglia that's involved, the thalamus that's involved, the striatum, and so it's kind of a loop, and this information comes around. But when those are sending impulses that are not correct or whatever, that's a bad clinical term, but when there's some disruption in those, then we have executive dysfunction. And so when you think about executive dysfunction, as you can imagine, it's when kids can't plan, they can't organize, they can't inhibit, they have difficulty initiating tasks. And there's several metaphors out there, particularly that I like to use. One is the conductor, and so the orchestra and all the different instruments, and the executive functions of the conductor that control those or help them work in conjunction. There's also, which is better visually on a presentation, the brain's air traffic controller. And so when EFs or executive functions work well, they can integrate cognitive and social and emotional skills. They pay attention, they plan ahead, things go well, and there's ability to prioritize. There's no pileups. This might fun. It didn't work quite as well as it should, but you get the picture. When there is poor executive function, there tends to be more mental collisions, stress, frustration. So when you're paying attention, you're trying to share your toys, you're putting on your boots, using words, and it becomes a complete mess and everything runs into each other. And so well regulated executive functions, everything works smoothly. When they're not, it's more stressful and frustration and inappropriate or unwanted behaviors are more likely. And again, here we go. I'm pulling my hair out when I struggle with executive functioning. Um, One of the other areas where we have executive dysfunction and where oftentimes families will come in to see somebody like me, a neuropsychologist, is with organization. And this is, again, I put in only my favorite cartoons. And this one I feel like is my desk right now. Um, and it says, Mrs. Jennings, have you seen my organization is the key to success poster? And there's oftentimes I have a lot of organization, how to organize your life, how to organize academics, in my office. And sometimes when it gets pretty messy, my kids have a very fun time pulling out those books and putting them on my desk. But it's where kids really do struggle to keep track of things, to organize. And then that in turn can also have other executive functions go awry. So the ability to be flexible if you're stressed and you can't organize and you can't find things, you'll get more rigidity in behavior, more cognitive inflexibility. And when I ask families and sort of look at, okay, well, tell me things that are going wrong or what sort of your concerns are. When looking at sort of managing homework and chores, do kids need reminders to start working? Do they need encouragement to keep working until they're done? Do the parents have to sit next to them until their homework is done? Do they need supervision? And handling routines? Can they do these routines independently, or do they need reminders? Do they need constant reminders? Organization, can they find the things that they want? Are you going back to the school to get books and papers? Are you calling your friends to find out what the assignment is because you didn't pick it up when you were walking out the door or didn't hear what assignment you have? Controlling behavior. So are they able to interact with their friends, siblings, family members, or are they stressed and frustrated and become very disappointed in their performance or when they're completing tasks? Um, so executive dysfunction presents often in different disorders. Unfortunately, they are not mutually exclusive to one disorder or another. So even though a lot of the times I'll hear, well, my child is really inflexible or they have a lot of rigid behavior, I think it's this disorder. That unfortunately doesn't always hold true. And so when neuropsychologists are doing our testing or our evaluations, even though that's coming in, we're thinking in the back of our minds, differential diagnosis. It can be ADHD. And Barkley used to argue that ADHD is a disorder or an impairment of executive functions, not just attention. These kids can have emotional difficulty. So if you're anxious, you can have difficulty with executive function, or if you're depressed, particularly if you're on the autism spectrum, they are known for cognitive inflexibility and being rigid in their behaviors. Also, if you have a traumatic brain injury, I worked in the rehab center at the hospital I used to work at, and lots of times we would have kids come in with head injuries. And this would be their key area that was really a struggle. They couldn't organize themselves. They couldn't remain, their inhibition was almost always impaired. Concussion also, so mild traumatic brain injuries. However, that usually they'll show executive functioning weaknesses, but it tends to recover over time unless we have, you know, um, long-term sequelae from a mild traumatic brain injury, sleep disorders. And I laughed at this one this morning as I was going over my presentation because I didn't get a whole lot of sleep last night. And I was like, I need to really be very organized and make sure and as you can see, it didn't work as well because I started late. Learning disabilities, lots of comorbid ADHD with learning disabilities. And then it also can have, kids can also, or individuals can have struggles with executive functioning based on medication and situational factors. So traumatic events can impact executive functioning. Um, there are also executive functioning challenges based on developmental factors. So if we're asking kids, as I said before, younger kids to do something, we wouldn't ask an infant to put on a helmet and go on a bike ride. We know they can't manage that. Or we're asking them to manage increasingly intricate, overwhelming information. And then again, who struggles most? Uh, those children that might have these neurodevelopmental difficulties, but also sometimes when looking and thinking about developmental trajectory of these skills is that a lot of the times in elementary school, if kids are pretty cognitively intact and they are working well and they've got a really good teacher or a really good school, we may not notice some of these difficulties until they get into middle school. And then, as I call it, they hit a wall. And maybe high school, and sometimes even college, so they can manage things. Their parents help with a lot of things. They sort of have external, organizational strategies in, place. I call them parents, the frontal lobes. But then they get off on their own, get into college, and they've got to manage social skills, social interactions, increased cognitive demands and academic demands, and they fall apart. Um, Another one, and I threw this one in just because, again, being a neuropsychologist, it says IQ test, and underneath it says this shouldn't be too hard. It's just the two letters. Again, just one of my favorite ones. And when thinking about assessment considerations, and I know this sounds odd coming from a neuropsychologist's mouth, but our measures of executive functioning, which we often will do. We've got the DCAFs, so we've got, TRAILS, which is cognitive flexibility, verbal fluency, which is verbal flexibility. We have the Tower test, which is planning and problem solving. And they are really good measures if they're interpreted the right way, because the ecological validity of some of those is still pretty tentative, sort of, they aren't foolproof. We can have kids come in and do really well on our measures, but still parents and teachers are like, they can't handle this in school. Once they have all those, they go into an environment, they don't show the same ability to manage those skills. Now, I am going to switch gears a little bit and talk about organizational skills. And these are so one of the things I love about this program itself is it looks at they're similar but overlapping skills of executive functioning, but they really are very specific about its organization. When looking at interventions for, improving or supporting executive functions, they're not typically evidence-based. We have, we want to, but in a lot of the times, if you read reports and things, it is looking at how do we organize kids? How do we help them with time management? How do we help them plan through tasks? And so this is an evidence-based program that helps with organizational skills. And they're in 4 different modules, and we're going to talk about that in a minute. Executive functioning is programs that look at that are kind of so there's like CogMed, that's a computer program that works on working memory skills, which again has some validity, but not for everybody. It's pretty intensive. There has to be a person that is at home with the child while they're doing the tasks. The fidelity of being able to do it is not always great. Sometimes it is, sometimes it's not, but it's usually typically based on who is monitoring the completing the tasks at home. And so, as you can imagine, life goes on, and sometimes they miss, doing the time on CogMed. And so, this is looking at more evidence-based an evidence-based program. And as if you know anything about the Baker Center, you will realize that we are very heavily evidence-based, which is a great thing. And that's one of the reasons why I'm at the Baker Center. So this program's based on helping children or individuals that struggle with using a daily planner, organizing their backpacks, bringing the correct books. So the things that we've talked about in some of the executive functioning, but termed more organizational, double checking homework, remembering to turn in homework. Um, so, and there's the 3 areas or 4 areas that they talk specifically about, which is OTMP, which is organizational skills, time management skills, managing materials, and planning. Um, so it focuses on 4 key skill areas, or what they call modules. So there's tracking assignments, which you can imagine is just tracking your assignments, making sure they're written down, making sure that you have, sorry, catching up with myself. I talk a lot. Making sure that your assignments are written down, following through, making sure that you have um, um, the materials that you need, which is the second one. So managing your materials and um, being able to know where your books are, having your pencils, completing the assignments to complete the assignments. Kids that struggle in this area, as I mentioned before, often call a friend, and friends get annoyed that they're often calling them, or they have to have their parents go back, and parents can be really frustrated, get very frustrated if they do this day in, day out. Time management is another one of the modules. So children have, and again, going back to that, they have difficult time understanding, where time goes. They're often late. They are often late turning in their homework or getting their home, or they start their homework. They're like, I only have this, this, and this. So they'll go out, they'll do dinner, they'll do that, and all of a sudden sit down to find out what they need to do, and they realize, oh my goodness, I'm going to be up until 1 o'clock in the morning finishing my homework. There's also task planning is the last module, and these are they're in a sequence of uh, consistently getting more complex tasks as you go along. As you imagine, tracking your assignments is I shouldn't say easier, but a less effortful task, hopefully. Depends on if I'm saying that, versus a child who may not think that's true, but they go through the different modules as more complex kinds of tasks. In this program, and I'm going to briefly go over that, and then we're going to kind of stop and take questions. So there's preliminary contacts. And so this program, again, is evidence-based. There's training for it. It's typically done, or it's been developed for therapists or clinicians who've been trained in behavior management and have worked with kids that either have had ADHD. This program was developed for kids with ADHD, so it can be used with other kids, but the velocity or the veracity of it is more with kids with ADHD. And so the preliminary contacts are 2 contacts, one with the teachers to assess OTMP, so organization, time management, and planning challenges at school. And to also, then the next one is to introduce the treatment process to the child's teacher. And we like to have teachers' involvement and have them help with, it's not a ton of involvement, but being able to monitor what the child, if the child is using these skills when they go to school, because you can imagine that's the most important place, and generalization is an important part of this. The next thing is introduction to for the parents. So it's 2 sessions. There's an orientation for the parent and the child to the program, and then also helping and guiding the parents in the use of social learning strategies to motivate skills, skill building and engagement, etc. And also that behavioral therapy or behavioral management piece as well. Then we're going to the 4 modules. So the first module, tracking assignments, is 2 sessions, introduces strategies, tools for recording and tracking school assignments. And these are in the book, which is really nice, so you don't have to reinvent the wheel. There are uh, at the end of the module, children should be consistently using a simple but effective tool for recording daily assignments. The next module is, again, the managing materials. So there's 5 sessions, focusing on methods for organizing papers, books, and work areas. The children learn and practice a new way to organize and transfer their papers. They develop and use simple checklists for effectively packing their backpacks. And towards the end of this module, children should arrive at school and home with the materials they're needed. It should be efficient in setting up their work area spaces and getting ready to work. The third area, again, is time management, which has 5 sessions focusing on teaching children critical time management skills so they can learn to estimate how long it takes to complete tasks, determine when to fit tasks into their schedule, and then also learn strategies for controlling what is called the time bandit. And this is part in the program in the organizational skills. There's a time bandit, which talks about, stealing your time and taking your time away. Module 4, time task planning, is 5 sessions, and you learn the components of good planning, breaking down tasks into smaller tasks, ordering steps, fitting the steps into the schedules, etc. And then there's the program summary, which I love this part. There's 2 pieces that I really think are key in this, is that they um, they meet with the therapist at the end to go over what they've learned, talk about tips and strategies on how to continue that, utilizing those skills, and then they create a little personal commercial, if you will. So it's a short audio or video that the student makes to tell others about what they've learned and about their successes. The other part of this that I love, which I don't have I mean, they have cute little cartoons and it's very kid friendly, but are glitches. And these are metaphorical, mythical creatures that supposedly live in our brains, and their mission or their job is to derail us from doing or engaging in organization, time management, managing the OTMP activities. And so there are 4 different glitches in the program, and one is go ahead, forget it glitch. The other is go ahead, lose it glitch. The time bandit, which I've already talked about, and then go ahead and plan it glitch. And these are glitches, so it helps kids sort of takes it away from their personally that they're doing things wrong and that it's a glitch. So it's not just them, it's this glitch that helps, that kind of interferes as well. And it keeps kids engaged in the program versus feeling like they're, you forgot it again. Well, there goes the glitch. We forgot it again. Um, Again, I've already gone over this one that talks about, that it should be a trained therapist or provider that's working in mental health, private practice, or a school setting, and that they've already had some treatment. A couple of things which I said in the beginning, and I do want to stop because I want to give us time, is that Baker Center has organizational skills training. We do those types of therapies. Other services, because I said in the beginning, I'm not going to talk about specific recommendations, but we have at the Center for Effective Therapy, which is where I am in Waltham, there's a Waltham and there's a Boston um, center. They're both together, but they're in different places. They have parent-child interaction therapy. There's match or modular approach to therapy for children. There's trauma-focused cognitive behavioral therapy. There's cognitive behavioral therapy. And then there's also parent training that happens. Again, I started in February and we now do neuropsych evaluations, looking at, all the neurodevelopmental disorders, and giving a understanding of brain behavior relationships, recommendations, diagnostic clarification. Um, and then we also have, which I learned about this summer, Camp Baker, which is an amazing program. It's a specialized summer day camp for children with mild to moderate symptoms of ADHD. Um, and then I just put in here so people have this information, how to get started if you want to make a referral or if you want to come to the Baker Center, or CET or both, and they are the same thing. Here's our website. If you go to bakercenter.org and there's a button that says Start Treatment, and that's the way to get both therapy and neuropsych assessments. So you hit that button, it'll come up with a nice saying, and that's it right there. If you'd like to begin treatment or schedule a neuropsych evaluation for your child, follow the steps below. We do a phone screen to start with the understanding, about a 20-minute phone screen to understand what the concerns are, make sure we're sending you to the right place. And then once you have the phone screen, we get you scheduled. Um, that's my talk. I appreciate, oh, and I also I'm going to go back. Nope, it's here. Nope, it's here. So questions, sorry. Our email, our phone numbers, our website, and then our social media. Um, so.
So it looks like we have a couple of questions in the chat. So let me pull.
Okay.
Okay, so our first one says, can rigidity about food choices reflect limited cognitive flexibility?
Great question. And yes, I believe it can, but I'm not I'm not RFID special. I'm not a specialist in food, but yes, we will look at, um, there's a lot of cognitive rigidity or inflexibility that can be co-occurring with food issues, also obsessive compulsive tendencies. So if they don't like their food touching, but I think that's part of the reason why we really do, at our center, we have the psych assessment that happens where we get into really in depth and talk about specific behaviors. And then if it looks like neuropsych evaluation, and it looks like there's also co-occurring other kind of behavioral rigidities, we would be able to look at that in particular. But I most certainly have seen lots of kids that have um, uh, executive functioning and cognitive rigidity that, if you will, spill into a lot of other areas, including food. Great question.
Okay, and our next one says, can neuroplasticity impact working memory past age 30?
Um, so my off the cuff is God, I hope so. But yes, and neuroplasticity is a great topic, one that is way too big to cover here. But we have, we're learning more that we used to think that our brains were kind of not flexible and growing and learning. And so if you had a traumatic brain injury at a young age, you were kind of not good, or we felt there was a not a good outcome. What we've learned is the brain really is very, can take over other, um, one area can take over other areas of functioning. And so the brain can adapt to certain areas. And it's amazing. I did my internship at Children's Hospital of Philadelphia, and one of the first cases I saw was a child with Rasmussen's encephalitis, which is a very devastating seizure disorder of one entire side of the brain, and the treatment for that is, a hemispherectomy. So, this child was 5 and initially lost all functioning for walking and talking and lots of things. But as he recovered, he took his other area of the brain, his other side of the brain started to take over. He walked and he was talking. And again, not 100% perfectly at the time I left him, but how the brain can really um, manage and take over other functioning is amazing. Working memory is interesting because working memory is sort of a short quick tasks or functions, if you will. And there's lots of other factors that can impact working memory. As you can imagine, attention can really impact how well our working memory works. I often will say, if you're sitting there and you're thinking about your grocery list, and all of a sudden you hear mom and you pay attention to your child, you come back and you're like, oh, wait, what was on that list again? And you got to start back over. So I think there is some, um, that our brains can sort of adapt to certain things with practice and with repetitive activities. But I also feel like there are a lot of other factors that would impact it. So you have to kind of look at all factors, if that makes sense.
So
Another
we're just
great
about
question.
at time, so maybe we have
Yeah.
time for one more question. And then if you do have other questions, please do email us using the
Okay.
information that you're seeing on screen right now. I can also put that in the chat. So we have, what does a lack of cognitive flexibility, if not supported, look like in an adult?
So, unfortunately, it can look pretty devastating. So a lot of the times, they're pretty negative outcomes. So people may lose jobs pretty frequently. They may struggle holding a job because they can't kind of um, be flexible. They might get into, you know, altercations or, because they can't kind of think and come up with alternative problem solvings. I often will say, it's almost like you're doing the same thing over and over and not learning that this strategy is not working. What other strategy can I do? It also, a lot of the times, individuals that really struggle with this inflexibility, if we're not supporting it, struggle in college or in high school academically, and those types of things. So again, it is one of the things. And I had somebody the other day mention to me that, oh, it's the buzzword. And it is a buzzword. Executive functions is a buzzword right now. However, they are here to stay. They are underlying there, are all of what we do. They're extremely important. They really, feed into how well children will do academically, how they will do socially. And it is an important thing for us to work on and continue to monitor and continue to learn and develop really great intervention strategies. We are at time. Alex, I lost you.
Yeah, it looks like we're about at time. So yes, if you do have further questions, please do email us. We'll be sending around a recording of this presentation shortly after this, so you can also re-reference some of these talking points as well. Thank you, everyone.
Thank you. Thanks for coming and spending your time with me.